Okay. So we'll be starting in a minute.
The iPhone is mine, oh.
It's yours. You've renamed it. Fantastic. Fantastic. How are you, sis? So we'll be starting in a minute.
Okay, good evening all, Dr.
Good evening and welcome. Welcome. So we think everybody now is appropriately named. We're good. So welcome. Welcome to Medical Mondays with Dr. O. What a beautiful day. Our weather in Maryland has been kind of chill, cool, and we're still enjoying, I think, the near close to winter, or I don't know how to describe it. But we praise God for the weather and for each other. Last month was Mental Health Month, but we didn't particularly address mental health. So we're starting this month with mental health. And before I introduce our august speaker, our amazing speaker, I want to introduce myself. I'm Toyin Okpesomi. I'm a family practitioner, treat HIV and drug addiction in Maryland. I love Medical Mondays with Dr. O because here I've learned so much to better my life and to better the lives of others. I've also had to, share the knowledge that, you have the opportunity to share, and we all learn every week. So welcome to this Medical Mondays, and we welcome to our family, Fola Kayode. I call her Fola favorably. She's a native of Brooklyn, New York, but guess what? We have inherited her in Maryland. A journey has taken her to North Carolina, and again, we got her here in the DMV area. She also is ex-military. She enlisted in the military and served our country for many years before she got into her next phase of life. She earned a Bachelor's of Science degree in psychology and a Master's of Social Work with a concentration in children and families, and currently pursuing a doctorate in healthcare administration. She wears many hats. She's a clinical social worker and therapist and is currently employed by the federal government. She continues to work and serve the military community and families across the state. She has organized and participated in several different community services and was recently involved in the Relay for Life work. She's an advocate for mental health, children, veteran services, and has several years of experience working with at-risk youth and adolescents, adults, and the military population. She does a lot in the community. She belongs to several organizations, including the Delta Sigma Theta Sorority, Inc., and many others. I must say also that she's an amazing MC. So if you have an event, call on her. I vouch for her. I've seen her in action, and she's actually going to MC my niece's wedding in a couple of weeks. So without much ado, I will yield the floor to our amazing Fola Kayode. The floor is yours, and welcome.
Hello, thank you, thank you, thank you for having me here, everyone. It's a joy and a privilege to be here on Medical Mondays with Dr. O. As Dr. O mentioned, May was Mental Health Awareness Month, and it is important, and as an advocate for mental health, mental awareness, holistic health, it's just very important for us to always address our mental health. So even though it was last month, it is something that we need to think about every day, 365 days of the year. And as you're thinking about your physical health, please also keep in mind your mental health, because mental health is health, and it is just as important, and in many cases can even be more important because we need it. And if you look at the essentials of health and well-being, you'll know that it is one of the key foundations to your overall health. So I want to start with a little bit about our holistic health, and I'm just going to try to make this very casual discussion, dialogue, but if anyone has questions, please feel free to ask. I'll try to pay attention. I guess Dr. O, afterwards.
After your talk.
Okay, perfect. Thank you so much, Dr. O. So just to give you a brief summary, when we think of prioritizing our health and our holistic health and self-care, we think about the essentials of maintaining overall health and well-being. Right now, a lot of us know that we're living in a very fast-paced society. We often have stress going on in our lives, whether it's due to family stressors, work stressors, stressors in our community, our environment. Holistic health, however, it encompasses our approach to not only what nurtures our bodies, but what nurtures us emotionally, our mental, spiritual aspects of ourself as individuals when we think of that. It is a multifaceted practice which recognizes not only the health to be interconnected with people, but also to have a balanced lifestyle. So we think about balance and how can we look at all those areas of our life, as I mentioned. It involves understanding your unique needs, your preferences, and adopting strategies that will help promote self-awareness and self-compassion. So we think about also being compassionate for yourself. Sometimes people are a little too hard on themselves. So it's really important to think about that as well. And I'll go a little bit into that as we talk about some self-awareness. It involves mindfulness practices, physical activity, nutrition, social connections, relaxation techniques. Each of those play a very vital and pivotal role in fostering resilience and enhancing your quality of life. When we prioritize our holistic self-care, we're able to think about the foundations of our personal growth, our emotional stability, and have a more fulfilling and meaningful life in our existence. Embracing this approach will allow us to not only recharge, to reconnect, and to reevaluate our goals. It helps us to also have a healthier life and a more harmonious life. So when we think of the things that we want to do, why are we not getting there, and who and what can hold us accountable for those things? We think of, we are those people. We are the person that can hold ourselves accountable. So one of the key areas that I want to talk about, and I'm going to talk about maybe 3 different areas, and I'll try to be brief because I want us to be able to have some time for dialogue at the end. We ask ourselves, what is self-awareness? I know we're not answering the question now, but I want you to think about, what does self-awareness mean to you? How do we understand our own thoughts, our feelings, and our behaviors when we think of self-awareness? The benefits of being self-aware is we're able to have a more enhanced decision-making. We have improved relationships with those around us, greater emotional regulation. Techniques to improve our self-awareness can be mindfulness practices. We talked about that before. Sometimes journaling, seeking professional assistance and support. We have counseling, there's mentors, there's therapy out there. Those are some ways. And sometimes even talking to a friend. Sometimes people are not always aware of themselves. And this is where other people in our lives can play a very valuable impact in being more aware of yourself. And we'll go back to that. Understanding, and I'm just giving you a kind of large picture right now, understanding emotional intelligence. I'm sure many of you have heard about emotional intelligence before, But emotional intelligence is the ability to recognize, understand, and manage your own emotions while also recognizing and influencing the emotion of others. Right? So it's not only do I recognize my own emotions, but how am I able to also recognize those around us? Am I situationally aware of what's happening around me? Am I able to make a decision based on the things that is happening around me so that I'm able to interact better with those people that I have to face on a day-to-day? Many people can relate to the fact that there's a lot of stress going on right now in our federal system, in our government system. And as a federal government employee right now, I'm seeing a lot of it. I work with a lot of people that are receiving services, receiving benefits, receiving federal funding to operate their programs. And because there's so many shifts, a lot of people are stressed, not only the employees, but also those that we're serving in the community. But how can we, as those that are caretakers and service providers and those in charge of programs, because I'm not in direct care right now, with that particular program, how can we make sure that we're giving out the best information and we're keeping people comfortable and safe so that they continue to trust us and they continue to trust that their lives and their livelihood is a priority, despite what is going on in our system right now and in our federal government. So components of emotional intelligence, we talked a little bit about what it is, but there's self-regulation, there's empathy, social skills, motivation, self-awareness, which we talked about before. That's a foundational element of emotional intelligence. The benefits of high emotional intelligence: you'll have better communication, conflict resolution, and leadership skills. When we think about how we can connect the two, we think about the fact that in order to connect both our self-awareness components and our emotional wellness important, we have to realize that being self-aware is what will foster the emotional intelligence. The role of emotional intelligence is the overall well-being and mental health. The impact on stress management and resilience is also being one. And the importance of wellness, when we think about why it's important to have this overall wellness, when we think of health and wellness, is because the holistic approach to health encompasses the physical, emotional, and social well-being, as we talked about before. The benefits of focusing on our wellness will also help us with reduced anxiety and depression. A lot of people are going through all types of anxiety, depression, and things right now because of loss of job, financial situation, financial crises, but how can we make sure that we're taking care of some of the things that we may not have a direct control over? And that's going to come back to how we're processing the information, how we're thinking about things. And this is where cognitive behavioral therapy approaches come into place, because people are able to now shift the way they think. That approach says, in order to shift my behavior, shift how I see things, shift how I view things, I have to change the way I think about things. And that's going to be important. You may not be able to change your situation, but how can we change how we're looking at the situation? That's what's going to be important. We think of better physical health. Strategies for promoting wellness will include regular physical activities. Are we taking a walk? Are we getting out? Are we getting into the sunlight on a day-to-day basis? Sometimes people are still working from home, but it is important to get out there, to walk, to exercise. We think about our balanced diet. Are you eating nutritious meals? Are you eating things that are well balanced out? Are we having, maybe if it's 2-3 meals a day? I know some people say it's a little difficult to eat 3 meals a day, but the times that you're eating, are you eating things that are nutritious? Are you getting adequate sleep? That one is a challenge even for me right now, with the many hats, Dr. O, that you mentioned. I try to balance between, okay, my day job, the business ventures, and how do I balance all of that out? Adequate sleep. As I'm talking to you, it is important to get your sleep. It is important for me to get my sleep as well. So what can we do to balance out making sure you're getting good quality sleep? Sometimes even just laying down. A lot of people, sleep experts, would say putting the phone down, trying to limit the electronics, the stimulus that the light rays are sending through your phone. Sometimes people say, oh, I can't sleep. You can't sleep, but you have your phone right beside you. You can't sleep, but you're having bright lights on your phone while you're in your bed. That's not going to help you go to sleep. So we have to practice good sleep hygiene and good practices. Those are some important things. Healthy social connections. It is important to have a social balance, a social circle, whether it be your faith organizations. Some people are involved in social organizations, groups, clubs, and other things. It is important to find a way to balance that in as well. It's good. Sometimes people prefer to be at home. That's fine. But what are you doing outside of your home environment that is also keeping you connected socially? Because again, we want to have balance. That's important. When we think of some ways to balance out our overall health, when it comes to self-awareness and when it comes to emotional intelligence, think of things that you can do on a daily basis. Is it walking I'm going to do daily? Is it journaling I'm going to do daily? Is it talking to a friend? Think of some different things when it comes to interacting with people, active listening practices. That helps when it comes to emotional intelligence as well. Techniques to enhance being able to listen from a place of empathy, truly understanding what people are saying. A lot of times people are listening from a place of, I'm ready to react, I'm ready to respond. I sometimes am guilty of that as well. But how can we all, as individuals, do better with truly listening to what people are saying so that you're able to truly understand and respond appropriately? It's also important to set boundaries. Setting boundaries and communicating your needs clearly also helps with people not taking advantage of the situation and you not feeling like your point is not getting heard. Practicing gratitude and positivity. Sometimes people will create a positivity journal. There are some people that will have a thank you jar or a things that went well jar. I know people that have done this in other groups where we've said, okay, each day, for throughout the year, each day, just write something you're thankful for, or each week, write something that has happened that you're thankful, whether it's gratitude. And then at the end of the year, you're able to go back and reflect on, when you feel like, oh, this didn't happen well, or God, I asked you for so many things, but life just hasn't been good, right? Because it's so easy for us to forget all of the good things that have happened and remember those one or two bad things that just didn't go the way we wanted it to go, right? I know that many of us here, if you are a person of faith or whatever the case may be, you've prayed about certain things and you said, okay, God, this is what I want. This is what I want this year. This will happen. This will happen. And we're at the end of the year and now it's November and we're like, okay, this didn't happen. And it's so easy to be upset, and start doubting things and start wondering, okay, why didn't this happen? But how many of us have actually took time out to say, despite what didn't happen, let me be thankful and reminded of what did happen. Let me remind myself of all of the good and amazing things that God has done for me. Maybe I had 20 things on the list and maybe it was 15 of them or 18 of them that came to pass. Instead of focusing on the 4 or 5 that didn't, let's focus on the things. And that comes into place with a matter of changing our perspective, changing our mindset, coming from a place of more gratitude and appreciation. So again, when we think about self-awareness, we think about emotional intelligence and wellness as a whole, it's important to encourage yourself into practices that are healthier for your overall mental state. It's important for us to think of things that we can do on a day-to-day basis to keep our minds active. We talked about coming from a place of empathy. We talked about coming from a place of a holistic approach. So we said it's important to feed yourself spiritually. So whether that's if you're a person of faith, being involved in your place of worship, being involved in those settings, whatever it is, whether if you pray, it's important to do that as well. We talk about the physical component, which is the walking, the exercise, the physical activities. That's important. We talked about also the nutrition piece, which is what are we putting into our bodies? How are we making sure that we're eating nutritious, well-balanced meals and a balanced diet? We also talked about our emotional side. We talked about emotional intelligence, coming from a place of emotional intelligence, empathy. We talked about being self-aware. That also ties into the emotional side, being aware of yourself, whether it's doing checks and balances with those people around you. We spoke of that. You can ask others, others will tell you. And then we also talked about the professional side. There's another side where it comes to maybe what you're doing with work, what you're doing professionally. That also ties into who we are as a whole. You know, are you satisfied in what you're doing? And if you're not, this is where people have opportunities to do something outside of what you're already doing. I know I was speaking with a group once about kind of what we do as professionals. Sometimes people get so consumed on, this is what I went to school for. This is what I've been trained to do. But who says we can't do other things that bring us joy and fulfillment? Who says that we can't do other things that we enjoy? Dr. O mentioned a little bit when she was talking of my bio about, social work and psychology, and some people say, well, how did you end up doing MC? What does that have to do with anything? Right? But the truth of the matter is I enjoy connecting with people. I enjoy sharing in people's joy. And left to me, I do feel like my social work, maybe the psychology and interacting with people, understanding people's mindsets, understanding how people think is probably what has made me to be good as an MC. I mean, I'm able to engage with the audience. I'm able to engage with the crowd. I'm able to relate with people. Sometimes people are shy. I can get them out there, so find what your niche is, find what you're good at, and do that. If what you're doing is not serving you right now, it may be what's paying the bills, but find things that you find pleasure in. Find other activities outside of your day-to-day that you can find joy and meaning in. Whatever it is. This platform here has been a good one, right? For many of you who come week after week, you hear different topics, you're learning about different activities, and sometimes it might even be something you already know, right? But there's a lot that comes in repetition. There's a lot and comes in hearing things over and over, and it allows us to stick. Some of the information that I shared today, we talked about self-awareness, we talked about emotional intelligence. Those aren't things that are new to any of us. Those are things that we are already fully aware of. Some people, I'm sure many of you already knew, May is Mental Health Month. May is mental health awareness. How many of us are really taking time to look into ourselves and see, are we aware of our own well-being? Are we doing the things that we need so that we can be our best possible selves? And if you haven't done so, this is where I really just want to kind of put out to everyone, if you haven't done so already, take time out today. It's only June 2nd. We're in another month right now. Happy new month to everyone. And, there might be another focus, but the truth of the matter is if you haven't already done some, whether we want to call it soul searching or, checking yourself, use this opportunity maybe later on this evening to just think and evaluate yourself. Am I living my best possible life? Am I fulfilled? What can I do to get me to the place that I want to get to? Because we've now gotten to the 6th month of the year, and there's still time to have all of our goals met. Some people will do vision board, and some people write plans out. They say, okay, this is what I want to do. This is how I'm going to get there. These are the goals. This is my time frame. And it's not too late. If you haven't already done what you set out to do in the beginning of the year, it's not too late. This is an opportunity for us to check ourselves. This is an opportunity for us to be a little bit more self-aware, to find out what we're doing and what we're not doing to get to where we want to go, and how can we actually get there. So I really just want to kind of stop there. I don't want to just talk and over talk, but I really want us to think of what are some ways, and I'll be able to, hopefully answer some questions, but what are some ways that we can get to where we want to go? And what can we start doing today to get us there if we aren't already there? Thank you, Dr. O.
Thank you so much. Thank you. You know what I appreciate a lot in your talk? And, I appreciate a lot of things in you. let me just say this. Let me say it this way. One of the things I appreciate in you is you live by example. This is you, and everybody on the platform, believe it. This is her. In person, she's more beautiful in person, but this is her. She lives by example. She does all of these things, and she's where she is because she's been able to have the self-awareness and been able to put it into works, into play. As she's very educated, she's sound in herself, and she goes out to beautify people's lives by emceeing. Just look at the spectrum of things. She treats, really counsels and helps in the mental health arena that is very important in our communities today. And then extended that to emceeing. She also does this 360 thing. What do they call it? I call it 360.
The 360 photo booth, yes.
Photo booth. Amazing. So you know the rules. If you have a question you want to ask yourself, you can raise your hand. If you're shy or you're busy, you don't want to talk now, you can put it in the chat box and I'll help you with that. But mental health is very important, and what Fola just presented to us, it's so sound, so rounded in a few minutes. And I just, appreciate that. Somebody, yeah. Sister Daisy, guess what?
My sorority sisters, for those of you that may not know what that is. Hello.
She's not just your sorority sister. She's also ex-retired military. Colonel, I think, Daisy. Colonel, oh no. She's above Colonel. Oh my gosh, I'm messing it up. Help me. But she's retired military, and I thank both of you and all other military folks on the platform. Thank you for serving. Thank you. Yes,
Lieutenant Colonel, she
Lieutenant
said.
Colonel. Okay, I'm close, right?
Yes, you were close.
Thank
You
you.
were
Thank you for
close.
serving. So you have a lot more in common than being sorority sisters. So, Dr. Ajagbe,
Yes.
shoot.
Thank you so much for the presentation. I'm not sure if I'm upright or sideways.
You're
Sideways.
sideways.
Okay.
You're upside down now.
All right. How about now? Upside down.
You're upside down. Okay, you're good now.
Okay. I guess because I'm mirroring my phone on the smart TV, so it's kind of giving me different orientation. Well, thank you so much for the presentation. It was very illuminating. About self-awareness, I think it's kind of like a very challenging place to be for many people because of not knowing how to balance the aspect of humility as well as self actualization. So people, I've seen many people that actually don't really try to say much about themselves. They try to downplay everything good about themselves. So I think while you were talking about self-awareness, as part of mental health, people should be able to be proud of who they are, not downplaying who they are and trying to say everything. You greet them, they say, don't worry, it's not me, it's not I think part of self-awareness is for us to be able to accept ourselves for who we are, not trying to be somebody else, just being able to embrace ourselves, not comparing ourselves to other people in a negative way. Uh, and one of the ways by which I think has helped me and I've shared with other people before is to ask people, have you ever written a love letter to yourself? If you've never written a love letter to yourself, you don't know how difficult it is. So what you cannot give, what you don't have, you can't give to others. So if you don't love yourself, it'll be very hard to truly be honest about saying that you love people. People throw the word I love you, oh love you, love you, love you, but then in practical terms it's very hard to show the love that they profess to have because they do not even have that straight love for themselves. So I think, I just wanted to add that to as a comment to what you've shared. I know it's not contrary to anything that you've shared. Thank you.
Thank you. Thank you so much. And you said something that kind of stuck out, was being able for people to take credit what they're doing, the good in them. I think that's really important. Or see the good in themselves, right?
Yes.
We downplay ourselves a lot, and if you're doing good, it's okay to acknowledge that you're doing good. It's okay to say that you're doing good. It's okay for other people to see that in you, but of course we all want to be very humble, as we should, but I think it's okay for you to feel good about the good that you're doing.
Yeah.
And writing a love letter to yourself is good. I think that that's something that can be a lesson and an example for many. Write good things about yourself. Talk about yourself. Embrace the things that you have, because there's sometimes I've seen some things out there where people say, the thing that you think is maybe not going well for you is someone else's prayer point.
Yes,
or God has already answered at least one of those prayer points, right? So let's be thankful for that.
Yep, absolutely. And I normally always just talk about attitude of gratitude. So that's what I embrace personally. And even by greeting, I always express that. Always grateful, always grateful. No time to be, down or to be downcast. Always being grateful, even when things don't seem to go well. Having the reason to say thanks on a continuous basis. Thank you. Thank you for what you shared.
Thank you, sir.
Thank you so much. Thank you for that. Mr. Charles Campbell Allen, you have a comment? You can unmute. Mr. Charles, where are you?
Yes. Thank you for the presentation. I am sort of a retired.
The volume went down.
All right, let me see if I can fix this. All right, can you hear me now?
Yes.
Okay, so thank you for the presentation. I am a retired, or I left the profession of social work several years ago. One of the things that I understand is that white supremacy is a system of Black oppression. I believe the solution is to use AI and other technologies to develop the tools, trainings to access and train adults and children, and to advocate for mental health curriculums in public and private Black K through 12 schools and HBCUs. I am also focused on creating this new system to achieve such a thing. My concern is that at a higher level, mental health is made worse by white supremacy. And when people don't try and acknowledge that it is at the root cause of much of the stress and mental health that impacts Black African American people, we are working at the impact level where things happen and we're dealing with the individuals But at the causal level, no one seems to want to touch that. And the sad thing about being a social worker is that I saw this repeatedly happening generation after generation, where systems were chewing up people, and social workers were tasked with placing a Band-Aid on someone. And that became disheartening and led me to leave the profession, but to focus on trying to look at how do we address the larger problem.
I can maybe chime in just briefly, because you said so many things. But we definitely have to look at the system. We have to go back to the root of things. But what can we do as individuals to make a mark, right? I think when I started seeing something not moving the way I wanted to on an individual level, when I was doing direct care and practice, I went and started working macro level. So now I have an opportunity to affect change on a larger scale, working with the federal government, from working in the clinics, which I still did clinic work on the side a little bit after, but now where I can affect change, right? Grants, funding opportunity announcements that actually impact organizations on a larger scale. And I was able to do that from a place of, I know, because I worked direct care, I worked in the field. Hello, can y'all still hear me?
Yes.
Yes.
Oh, I'm sorry, my screen went completely black. I don't know.
No, we can see you and we can hear you.
Okay, I'm not sure what is going on here. Sorry. Okay, I'll continue. But how can I affect change on a larger scale? And I was able to do that by switching my position, but not really switching my role. I love social work, and so I think, to your point, yes, a lot of people are affected and impacted. I saw someone put a comment also about males, not being as emotionally aware, maybe not getting the support that they should, but it is really okay for all of the men in here. And I know that that individual also had a comment. It is okay to feel, it is okay to share your emotions. It is okay to talk about what is affecting you, because together is how we can make change. Even in situations right now, I know a lot of people feel stuck, and I have to address this. A lot of people feel stuck with the situation that's going right now in our federal government. We can't speak too much on that, but it's affecting us all, regardless of who you voted for, regardless of your political affiliation. It is something that is affecting all of us. And it is very important to be aware, self-aware of how that's affecting you, and find out what you can do, what some outlets may be in order to make it through the day, to make it through the month, to make it through the year. So I just want to I know that maybe it doesn't answer your question, Mr. Charles, but I think, if it's a position, if it's a field that you love, you can still affect change. Even it just takes one. Sometimes one person can really be the change, that we want to see, and we just can keep pushing. And I just want to acknowledge my dad that's also here on the line. I see him viewing as well. Definitely, he's someone in the human service field, retired now, drug addiction counselor in New York for over 30 years, counselor. So I'm just happy to see him here as well. But so I just thank you all. Doctor, I'm going to hand it back over to you in case there were other questions in the chat that we need to address.
Yeah, there are other questions. Mr. Charles, what you brought up is very deep, and I would like us to come back to it. I would like to also acknowledge Dr. David Kayode, all the way from New York. Yeah.
Thank you.
I thought you wanted to speak, sir. Thank you so much.
Yes, I want to.
Yes, please go ahead. The floor is yours. And thank you.
Yeah, it's just
thank you for the gift you have given us in Fola. Thank you.
Thank you. It's just I'm really inspired by what the young lady was talking about. I'm one of the people that doesn't do much about my health at this age. I'm all about 75 years old now, but I don't do all what I'm supposed to do, which I think, but they always be in my case that, Daddy, you have to do this, Daddy, you have to do that. But when you have somebody that can inspire you, it's like when in the counseling they say, I would like to go to where they know my name. Mostly when you see someone that can help you to remind you of what you cannot think of, because there's sometimes in life that you're out of it. You don't remember everything. But when you have somebody, this is what this young lady is doing now, to tell us about how we can be nice to ourselves. Yeah. Like our brother that just spoke said, self-love is the best love. How many times have you ever write yourself a love letter? So, this thing that we are hearing now, give me a open mind to see how I can reach out to the other more than what I've been doing. I'm really inspired with this, and I love it. And thank you for bringing me to say something about this young lady that, I can say like father, like Sedora. So thank you.
Thank you so very much, sir. We appreciate you. Thank you. And you are only 75, you're still very young.
I know.
You've got to take care of you, and you have to do what, when you say like father, like daughter, she actually lives out what she preaches. So you have to take care of yourself too. And that will make us all very proud. And thank you so much again. Thank you. God bless you.
You're welcome. God bless.
Thank you. Thank you. So I have some questions in the chat box. Dr. Francis Alu says, thanks for your presentation. What do you suggest is the best way to handle children who are heady and are easily influenced by their peers? Talk of Teenagers is describing that teenage group.
It's kind of just the society, unfortunately, that we're living in now. A lot of people are influenced by peers, what they see on social media, all of these different apps that they have now. Everyone wants to be like the next person. And, I used to work in group homes. I've worked with a lot of teenagers, and it was what I saw a lot. I think they need to just really, I would say, be around more positive influencing people. Maybe if there's groups that they can be a part of. When we were teenagers a long time ago, I was involved in after school programs. They had teen work experience programs, getting them involved in after school activities, whether it's a support group, maybe at the church, whatever the case may be. I would just extracurricular activities, I would say, would be also helpful in situations like that. And then maybe getting them to talk to someone, a mentor. They have Boys and Girls Club offers mentorship. There's counselors out there that specialize in working with youth and adolescents to find out, okay, the root cause of why they're so interested in being like their peers, especially the peers that aren't doing the right thing. Maybe there's something that they're seeking. Maybe there's something that they're missing that they're looking for. So I would say getting to the root of that would be helpful.
Thank you. Thank you so much. Abiba Bickersret, she's also in counseling, said, the love letter is just a good example of self-care. And she thanks Dr. Ajagbe for the idea. I think we'll check that. Dr. Ajagbe, thank you. You have your hand raised. Go ahead.
Yes. Yeah, there are three things I wanted to make comments on. The first one is part of being self-aware is when people recognize some certain aesthetically unacceptable features of themselves. So, for instance, somebody who has very bad crowded teeth or premature loss of teeth, such individual will not smile openly, and even when they know that it's best for them to smile, but they will not smile because of their self-consciousness about what their appearance looks like. And many times, if that is the case, if somebody has, for instance, as a dentist, one of the first things I see in people is the smile. I may not know anything about you, but the moment I meet you, once I see your smile, I can tell about so many things going on in the mouth. So for some people, that affects their self-esteem. Their appearances, when they don't look attractive. Particularly, I want to talk about those children that are mouth breathers. If you see children, young people that are breathing through their mouth, they have abnormally longer face, and their mouth is not always very clean because they form more plaque. And the reason I'm saying this is this: if we are telling them to have self-awareness and they don't like what they see in the mirror, and they don't have anybody to help them either through diagnosis and treatment, or being abused by their own loved ones themselves, family members making fun of them, telling them they're stupid because of their appearances. Some of these things can truly have negative impact on such individuals' self-esteem. That's one. The other thing I want to talk about is sleep. You mentioned sleep. Quality of sleep is very important. But a lot of people don't know that they have problem with sleep because of their jaws. The developmental abnormalities that occurs in the face, particularly in the upper and lower jaws, can affect the quality of sleep. We've talked about sleep on this platform several times from this, anatomical standpoint. So anyone who is not sleeping well, and it has nothing to do with electronics or social media or anything, but they still have difficulty in sleeping, they need help. They need to find help. First of all, they need to be diagnosed. One of the diagnoses that we can do is we find that somebody that has, big tongue, very small mouth. There is nowhere the tongue can go but the back of the throat. And when the tongue falls to the back of the throat, they can't breathe at night. And when they can't breathe at night, they will not have good sleep. And it affects the oxygen saturation in their blood, which affects their cognition long term. So some of these things are connected. And the third thing I want to talk about has to do with breastfeeding. For young people who are childbearing age, the best gift you can give to your child, your new baby, is breastfeeding. Because if you don't, their jaws will not be well formed, their tongue will not be well formed. They will have abnormal swallowing, and they will have difficulty in growing their jaws. They will have crowded teeth, and in the future, they will be spending so much time and money for therapy, not just for correcting the malocclusions or the crowded teeth and crooked teeth. They will be having problem with their lungs, breathing and swallowing and aspiration. All these things are necessary to be watched. So please, those who are childbearing age, women, please give the best gift to your child. Breastfeed them.
Thank you. Hello, Dr. Jagwe.
I can hear you. Yes.
Okay. Thank you. So, Miss Yolanda Edwards, kindly unmute. You said you had something good. Great.
Yes, hello. How are you?
Fine, thank you. How are you?
Wonderful, thank you. I just wanted to say what a wonderful platform I think this is. A lot of the techniques and things discussed today are so important to do, not only as an individual, but as a family. Talking to your children about wellness and how they feel about themselves and self-esteem. I think it's just really great to start from young so that you can build mentally healthy adults. This is great.
Thank you. Thank you so much. Appreciate that. We learn a lot on the platform on different subjects. So thank you.
Thank you.
Dr. Zugu, kindly unmute. You have your hand raised.
Okay.
Great.
Yeah, thank you so much, Fola, for your presentation.
Thanks.
Excellent. You hit some points. I just wanted to help us, in some areas. I wanted to just comment on, for you to comment on area of like self-awareness in terms of positive self-awareness and negative self-awareness, physical self-awareness and spiritual self-awareness, and how can we enhance this on our children in terms of enhancing the positive aspect of it to help them deal with these issues, especially the impact of technology and even just self-relationships and stuff like that. If you can just give us some guide on this area, that'd be great. Thank you.
Okay, thank you.
Sure.
So when we think of self-awareness, you mentioned the physical and yes, the negative aspect of it. I think it's important to be aware of both, right? A lot of times people will harp maybe on negative sides of themselves, and some people just on the positive. They don't even see the negative in themselves. So part of being aware is not just to be aware of the good things that you're doing, but the negative things that we're doing and how those negative things impact other parts of our lives. There's some things that we can all agree that we're doing that is not beneficial to us, and those things impede other areas of our lives. I know that one of the things that was mentioned was about sleep. We talked about, yes, it may not be an electronics piece. Some of the things that I don't remember his name, but that he mentioned a little bit earlier, he described something that sounds like sleep apnea, right? That's a medical. Okay, yes, and you're the medical doctor. Sorry, doctor, but that's something that's a medical situation. That's something that should be assessed by a medical professional. That's something that people should look into a little bit further, because if that's left unattended can help affect you in other areas, but so there's different things that we have to be aware. Some people will say, oh, it's just this, but no, what is going on with you? How can I assess this? How can I get the treatment that I need? It's a CPAP machine. Do I need to lose weight? Often you find that in those individuals. So there's just different things that we need to do when it comes to being aware, just not only on the positive side, but also on the negative side. If there's some negative things that we're doing, and this now comes into the emotional intelligence piece. We talked about, sometimes identifying things in ourselves that maybe other people tell us. Are there other things that people are pointing out? If we're not able to point out those negative things that are affecting people, how can we do something about the things that maybe aren't going so well? Are we looking down our list of the things that have gone well and the things that are not, and saying, okay, what am I doing to maybe not get me to where I need to go? Maybe we have to shift some things in our own life in order to get where we need to get to. You mentioned children and youth. And I think, as mentioned earlier, starting now, if you have children that are young, how can we incorporate some of those things into their lifestyles from a very early age? Exercise, wellness, what are they eating? What are they watching? Right now, it's been so easy to put kids in front of the screen, in front of YouTube. They know all the channels, the songs, the dances. But if we can really think back to some of us when we were younger, we didn't have these things. We went outside, we interacted, we played. That's why a lot of children right now are not able to interact with their peers. They're not able to hold conversation. They're not able to look at people in the face. They're not able to do all of these things because they haven't been doing it. They've been in front of the TV, especially those that were born during the time of pandemic, but how can we move from what we've been doing for the past few years to a place of being better? These are all things that we have the power to do now. So I think it's just really us taking some ownership is probably a place that we need to start at.
Thank you so much.
Thank you.
Thank you. So, Sister Maria Bassi said not knowing who she was and her worth led her to looking for validation from people in the past. But today, she knows who she is. She's no longer seeking validation. The self-love letter part, she said, got her so deep. And she says, thank you for this awesome presentation. And Dr. Kayode, Dr. David Kayode, I love this, says he's really inspired by this young woman in a time like this with what is going on in our world when many are busy to remember when to do the right thing when it comes to their health or health awareness. And it's very right on point. So many things are going on. This is a very needful conversation. And Fola, thank you again for creating this awareness. Dr. Ethel Akwaba said, thank you for an excellent presentation. Important to always address our mental health issues in our communities. And another question for you, Dr. Alu says, what is the psychological explanation why women are happier and live longer than men? I love the question.
I think that also goes back to one of the points that was made earlier about women maybe addressing our emotional and mental health a little bit more than men. I mean, that's something that we can talk long and long for. So I don't know if we can even really get into too much of that. I think that this is something that we should definitely have another discussion on, because as you know, Dr. O, mental health is so important. I don't even think it can all be captured here today. And I see so many really good questions, thought-provoking questions. But even studies have even shown, and this one is statistically backed, that men don't even address their mental health the way women do. A lot of men don't want to address, they don't want to go to counseling, they don't feel anything is wrong. And it's not that something has to be wrong, to even go to counseling, to go to therapy. Sometimes people wait. When it's something is wrong, it's already too late, to be honest. It's important to start addressing these things now. We don't want to address things when we're already sick. They say eat right. We're not waiting until the doctor says you have to do those things. These are things we need to do now. When it comes to our mental health and wellness, that's what we talk about now, self-awareness, mind, body, and soul, how each part of us affects the next part of us. And these are things we have to start today. They talked about the love letter, self-help. What can we do? Walking, exercising, all of these different things. It starts today, day by day. All of this is a part of what is going to make us a better person and a more holistic person. So let us think about how we can start all of these things today, and not waiting until it's too late to address our overall wellness and our overall health.
Thank you so much. Thank you for bringing up counseling. We all need to be in counseling.
Mm-hmm.
I didn't until my children actually had a meeting and called me out. And I found out that night that my coping skill in life up until then had been just forgetting that whatever happened. I mean, actually forgetting. An incident was brought to light, and I was like, wow, I actually forgot it happened. And that wasn't a good coping skill. So we all, one way or the other, need counseling, somebody to talk to, even when we think everything is okay. Thank you for saying that, for bringing that up. There's a stigma against mental health in our communities, and it is time that we break down that barrier. We've been trying this on Medical Mondays. It's working. We're reaching a lot more people than we started, but we still have work to do. Thank you. So Miss Cassandra Ewing, Dr. Cassandra Ewing said she thinks there's a fine line between being authentic for oneself and being happy, then being sensitive to how others feel in our presence to make them feel comfortable. Let me read the question directly and not use the third person. Maybe you'll make it clearer. It says, I think there is a fine line being authentic for yourself and being happy. Then being sensitive to how others feel in your presence to make them feel comfortable. So any comments on that?
I mean, I think that also takes us back a little bit to being self-aware, right? How do we make other people feel? Some people will say, oh, I don't care. I don't care what people think. I don't care what people say. But we should care. You know, the truth of the matter is we should care what people say. We should care how they feel. Maybe not so much as what they say, but how we are making those that we care about feel, how we're being perceived. You know, that's also being self-aware, right? Sometimes it's not about what we're saying, but how people are receiving it. You know, you may mean well, but if it's not received well, then that's something we have to look inside of ourselves to assess, okay, what message am I trying to portray and why isn't it being passed well? Sometimes I have to do that when I'm having conversations with some of my peers, you know, and other people. Maybe I'm not saying it right. Maybe they're not hearing it right. But it's important for us to sometimes take a step back and reflect and see how we can also do better to get the message passed a little bit better.
Excellent point. Thank you. So Yemisi Dowu said, thanks for sharing. That's so enlightening. How does one demarcate between self-awareness, self-worth, and self-pride? That's deep. Self-awareness, self-worth, and self-pride. How do one differentiate, or she used the word demarcate?
Okay. So I'm trying to see the best way to answer this because we talked about self-awareness, right? Being aware of oneself, right? That's our individual awareness. When we think of self-worth, knowing your value, right? Knowing what you're capable of, what you are able to do. But maybe there's going to have to be an element of self-awareness before we even get to knowing our worth, right? And being able to place value on that, on yourself, and not dimming your light. You know, we talked a little bit earlier about sometimes not giving ourselves enough credit. You have to know your worth. You have to know what it is that you can do, what you bring to the table. And then you said self-pride. We don't want to be over prideful, right? But there's nothing wrong with being able to know where you stand, what you're good at, and know what your worth and your value is. So I'm not really sure about the self-pride piece, or maybe what's being asked there, but I do think that it's important to be self-aware and definitely to know your worth. But I think the worth probably comes from first being aware of who you are as an individual. And I don't know, maybe Dr. O, if you know how to address the self-pride piece.
Yes. Sister Idow's question is deep, and it's very critical. It's very important because there's a fine line between self-worth, appreciating oneself, knowing what you're worth, and self-pride. If one is not careful, it will lead to pride. When you have the ability to do certain things, if you're not careful, you may become prideful. And one has to guard that, because pride in any way, any form, does not end well.
Yes, absolutely. And someone just put something too, that talked about as care providers, we sometimes tend to forget about ourselves while we're trying to save everyone else. And I feel like that could be a good even closing piece, because it's so important. One of the things that I'll never forget when I was in graduate school was in one of the courses, she said, one of my professors, Dr. Chavis, we'll never forget her. She said, even the therapist needs therapy. Okay. Even the counselor needs counseling. We can never be above that, you know, and I'm not ashamed to say I've been to counseling. I've been to therapy. Absolutely. I have. Insurance pays for it. I've gone to free ones too. It is okay, you know, to seek outside for guidance, mentorship, counseling, therapy. We all have things that we can talk through, process through. We cannot be the own experts of ourselves. Dr. O is a doctor. She cannot doctor on herself, right? You know, so everyone is going to need to seek outside consultation, and that is okay. There's nothing wrong with it. We talked about stigmas. You know, right now we're trying so much to do better, and I do feel like we've come a long way with trying to destigmatize mental health, wellness, care, all of these different things. But I think, one of the things that you mentioned is we do forget ourselves. We do, and we have to be conscious in making those decisions and those conscious efforts to take care of ourselves. Whether it's saying, let me go out and have my own session, let me go and get a massage, let me go ahead and walk, taking a break, because sometimes we can get to a point where some of us may even experience what they call vicarious traumatization, now taking on other people's stress on ourselves if we don't have an outlet for ourselves. And that's something that we have, that's very real and something we have to do. So thank you for bringing that up. I think that's something that all of us can take from, is to make sure we're taking care of ourselves as we are trying to take care of everyone else.
Yes. Thank you. Thank you so much. Sister Omira is also a counselor. I've asked her to unmute. She said, as providers, we sometimes tend to forget about ourselves while trying to save everyone else. So kindly chime in. She's an amazing counselor. She's stepped in for us in a lot of ways.
Yes, I think this is an excellent presentation. And we often, as care providers, we're trying to save everyone all the time. And we'll go overboard. We just do everything to help everyone else. And in the midst of that, we tend to forget about ourselves. We forget our needs. And it takes a lot of energy to help others. It's a lot of energy. And we don't even realize that that draws from us. So we constantly have to keep self-awareness in mind, because we can't help others if we're not at our optimal state. So we have to remember everything, the spiritual, the physical, the mental. I think this is a very needed topic, and I thank you for presenting tonight. You spoke very well. I feel very blessed, and I'm just very, very happy that we constantly have to get back to that, even because we're always working all the time. And thank you so much.
Thank you. Thank you for all you do also. God bless you. So Dr. Ajay said, self-awareness is about reflection and growth, while self-pride is more outward-facing and often based on comparison. If you find yourself thinking of saying, I am better than others because of X, you may be crossing onto unhealthy self-pride. Self-worth is unconditional and doesn't require validation, while self-pride often depends on external recognition. Thank you so much. On point definition. Fola, what do you think?
No, I was just looking at that too. Yes, no, I think that definitely well put. Sometimes people do seek outside validation and acknowledgement. And maybe, yes, that could definitely be where the pride comes into play. So thank you for spelling that out. I think it speaks for itself right there. So thank you.
Thank you. Dr. Jagbe thinks you should be your own best advocate and cheerleader. What's your comment on that?
We definitely should advocate for ourselves, but I'm still of the mindset of, that line between being over prideful, in the midst of us knowing our self-worth and knowing our value. But yes, cheer for yourself, advocate for yourself, because if you don't tell your story, who will, right? If you don't speak about what you do, nobody's going to know what you do. But we should also still be mindful of that. There's a time and place for everything as well. So, but yes, absolutely cheer for yourself, clap for yourself. Sometimes you may be the only one clapping, and that's okay. But so I just thank everyone for being here today. Thank you, Dr. O, for this opportunity.
Ms. Stanton has something to tell you.
Oh.
She said, great message and presentation. And thanks for emphasizing that we all need some form of therapy and no one is above counseling.
Absolutely.
On point.
Thank you.
Thank you. Yes.
Thank you so
So
much.
what would be your parting words for us before I talk about Dr. Izugu's book?
Okay, just imparting, thank you all for everyone being here with us this evening, for this opportunity and this platform to just share about mental health. I think her message here about no one being above counseling or therapy is right on point. I think that would be my best parting words. You know, as we think about not only Mental Health Month, but as we think of whole health, as we think of a holistic and more a holistic approach to life, you know, just think of mind, body, and soul. You know, don't just do one without the other. Think of your physical, your mental, your emotional, all of those areas and how each affects each other. So I just want to say that as you're feeding yourself mentally, spiritually, physically, emotionally, do it all in order to have the best possible you. So thank you, everyone. Be blessed.
Thank you. Please, can you post your contact information in case people need to contact you?
Okay, yes.
They need MC, the 360 photo booth. I got it now, 360. They need that, you know, so they can contact you for anything else. Sister Omira said spirituality is extremely important to staying well balanced, and that is true. So while Fola is posting that for us, I just want to share that this Saturday, Dr. Camilo Sezugo launched the book we talked about, The Good Success. And it was a very successful launch. And in case you were unable to participate virtually or in person, we've posted it. Thank you, Dr. Ajay, for posting this in the chat box. You can just use the scan to scan it, or copy the code, and you can purchase the book. All proceeds go to HDPTC, which are, I'll let Dr. Izugu unmute and tell us some about HDPTC and what this is all about. But the proceeds of the book do not go to him. It's to help humanity. And I would suggest that, you purchase the book for any amount. I would suggest it's at least $25. I know. Thank you. Dr. Izugu.
Yes, sister. Thank you so much. I think to talk about HDPTC might be a good idea to just show the video of what HDPTC does and why we believe in, really supporting that. So I think AJ is showing this thing now. Okay. So give me a moment, if you don't mind. I can share the video if you don't mind. So let's see here. Oh, let me reshare Jan, see if she can share the video, what I can share from my end. Okay. Sorry. All right, while we are trying to figure that out, I can just, HDPTC is a nonprofit, which stands for Heart Disease Prevention and Training Center. It has branches in Nigeria, many states, and also in other countries, including Mozambique and Ghana. And the primary goal is really to prevent heart disease and really reaching, okay, let me play this, and then we will talk more about that. Let's see.